How can we help America's economy recover? One way, expanding and improving Medicare, our country's most popular health plan. Lowering eligibility to age 60, even if you're working or self-employed, means lower costs for small businesses and more secure benefits for you. We can even add hearing, vision, and dental benefits, paid for by letting Medicare negotiate discounts from Big Pharma. People across the country agree. It's time for Congress and the President to act.
Welcome, everyone. My name is Melinda St. Louis, and I'm from Public Citizen. And on behalf of the 47 co-sponsoring organizations for tonight's event, I'm honored to welcome you all to this exciting Expand and Improve Medicare Town Hall, featuring Representative Pramila Jayapal, Representative Susan Wild, and healthcare leaders. We're gathered tonight because Congress has a unique opportunity right now to deliver on key healthcare promises in its sweeping legislative package that President Biden has called Build Back Better. The organizations and members of Congress participating in tonight's town hall don't always see eye to eye on improving healthcare access in the United States. But this time we've come together united in our call to Congress to include common sense and overwhelmingly popular policies in this upcoming bill, which we'll talk about tonight. That's namely to expand Medicare by lowering the eligibility age from 65 to at least 60, to improve Medicare coverage to include dental, hearing, and vision benefits, and to cap out-of-pocket costs, and to enable Medicare to negotiate lower prescription drug prices for everyone. We will hear stories of healthcare struggles from patients, workers, and employers, from members of Congress, and we'll hear from leading healthcare advocates from hearing and vision benefits and to cap out-of-pocket costs, and to enable Medicare to negotiate. National Nurses United, Public Citizen, Families USA, and more. We want to thank the thousands of people tuning in from all over the country. We've gathered together tonight to show Congress just how urgent it is to expand and improve Medicare now. This is very timely because important decisions are being made in committees this week, and Senate Democrats released their top-line budget resolution just late last night that includes healthcare priorities. And there's more discussions happening in coming weeks. So please take a moment during this town hall to go to the link at the bottom of the screen, strengthenmedicarenow.org, to sign the petition to congressional leaders. And stay tuned for more opportunities to get involved in coming weeks. So I'm honored to be your moderator this evening, and I will begin by introducing one of our most stalwart healthcare champions in Congress, Representative Pramila Jayapal, who represents Washington's 7th Congressional District and is the chair of the Congressional Progressive Caucus. Welcome, Congresswoman.
Melinda, thank you so much, and welcome and good evening to everybody who is out there. This is a really wonderful moment to be doing this town hall, and I want to thank Public Citizen and all of our partners for standing up and speaking out at a pivotal moment in the fight for healthcare. We are joined by incredible organizations who represent a wide coalition of groups united in calling on Congress and President Biden to quickly expand and improve Medicare. And I especially want to thank my colleagues that are here with us tonight, Representative Susan Wild, and then we'll have video from Representative Connor Lamb and Representative Haley Stevens as well, who have been absolute champions with me in pushing for this pivotal moment of expanding Medicare, ensuring that we can provide these benefits, dental, vision, and hearing, to our seniors, that we can lower the age of eligibility for Medicare, and that we can ensure that no American pays more for their prescription drugs than in any other country. Our country is still recovering from an unprecedented, devastating, and deadly COVID-19 pandemic that took our broken for-profit healthcare system from bad to worse. At a cruel moment when at least 100 million people are uninsured or underinsured across the richest country on the planet, we need to invest in healthcare. We need to invest in health security, and we need to invest in ensuring that families are able finally to meet their healthcare needs in the coming months and years. Now, last summer, I was honored to co-chair the Biden-Sanders Unity Task Force on Healthcare, where we gained a commitment back then to expand and improve Medicare. Building on that commitment, I, along with Susan and Connor and Haley and many others, 70% of the House Democratic Caucus, from progressives and moderates to those running in the toughest races across this country, sent a letter urging the president to improve and expand Medicare as part of the American Families and Jobs Plan. We have continued our advocacy on every level, within the House, within the Senate, and with the White House, because we have this opportunity right now in Congress to go big and bold with the infrastructure plan. That's why for healthcare, we are calling for three things. First, expand Medicare by lowering the eligibility age. Second, improve Medicare benefits to include dental, vision, and hearing. And third, empower Medicare to negotiate down the cost of prescription drugs for all Americans. That's actually how we pay for these critical services, but it's also just the right thing to do. Now, just last night, as Melinda said, thanks to the incredible advocacy of people inside Congress, outside Congress, all of you on the line with us tonight, Senate Democrats announced a top line budget number of $3.5 trillion for the infrastructure package, which is set to fulfill one of our priorities and improve Medicare benefits with dental, vision, and hearing, and also keep the possibility of lowering the eligibility age alive, as well as providing an opportunity for us around prescription drug pricing. Right now, because the lack of benefits for hearing, dental, and vision has severe consequences for worsening a whole host of other medical conditions and negative outcomes, including diabetes, depression, and risk of falls, too many seniors are just not able to get the care they need to prevent these health concerns simply because they can't afford it. Improving Medicare to millions of additional seniors will address this head on. But we need to be very clear. Not only must we improve Medicare, we also have to expand it and provide immediate coverage for millions of older adults who are still uninsured or underinsured. These popular, necessary, and urgent changes can't wait. The moment to deliver is now. Doing so would give 23 million older workers the security of knowing that they can finally address illness and injury and not worry about how they'll pay for a doctor. Today, up to 25% of adults ages 60 to 64 experience being uninsured prior to becoming eligible for Medicare. In fact, a Stanford study found that those aged 60 to 64 had a higher likelihood of dying from cancer than those 65 and older, simply because they don't have Medicare. At a moment when we have been facing unprecedented public health and economic crises, older workers are particularly vulnerable. Not only are older workers staying unemployed for longer periods of time, the higher costs of employing older workers are large enough to keep employers from even hiring those older workers. And that's resulted in an uptick of older workers who are leaving the workforce, relying on savings, retirement funds, or claiming Social Security early. We can pay for all of this by finally taking on the greed of the pharmaceutical industry and demanding that big pharma stop ripping off US taxpayers by charging us the highest prices in the world for prescription drugs. Right now, Medicare is the largest purchaser of drugs in the world, but it is not able to negotiate drug prices, and we see the devastating results every single day. If we just allow Medicare to negotiate and set drug prices at the median price of other major countries, the Congressional Budget Office estimates that we'll save taxpayers at least $500 billion over the next decade. And with those savings, we can finally make drug prices affordable for all Americans. We can give Americans over 60 the security of having Medicare and expanding the benefits that Medicare provides to include that all essential dental, vision, and hearing. Not only is this good policy, it's wildly popular policy, even in swing districts, frontline districts, and with Republicans. According to a recent poll, 65% of Americans, including a majority of Trump voters and a majority in every state across the country support lowering the Medicare age. Another recent poll found that 83% of voters support expanding Medicare to cover hearing, vision, and dental, including 76% of Republicans. So it's clear and it's simple. Medicare is one of the most popular, effective, and foundational federal programs in our nation's history. And as we emerge from the COVID-19 pandemic, this is a historic opportunity to make this critical expansion of Medicare that will guarantee healthcare for millions of older adults while finally getting seniors the services they desperately need. Now, I've been an organizer my whole life, and I know that sometimes as organizers, we fight so hard, we forget to celebrate our wins and our victories and the steps along the way to those victories. And so tonight, as we continue to push to make sure that Medicare expansion, lowering the age, adding the benefits, and negotiating drug prices, we're going to continue to push to make sure this stays in all the way to the end. But tonight, we should also celebrate that just 3 months ago, this was not even on the table. It was not in the president's plan. We, the movement, were able to do the work necessary so that President Biden spoke about it in support during his speech to Congress. But more than that, we were able to get it into the package. And so there's a lot of work to do to make sure that we continue to push to keep these 3 things in there and to make sure one doesn't get left out. But thank you for organizing on the outside. Thank you for fighting for this and never giving up hope that we could make this happen. And thank you for doing the work that is necessary to take us all the way to the victory line for the people. Thank you so much, Melinda.
Thank you so much, Congresswoman Jayapal. We are so, so grateful for your leadership on so many issues and especially on this one. Next, we're honored to welcome Congresswoman Susan Wild, a frontliner who represents Pennsylvania's 7th Congressional District after winning her seat in 2018, previously occupied by a Republican. Thank you so much for being here, Representative Wild, to share your insights on Medicare negotiation to lower drug prices for everyone.
And thank you all for having me, and particularly thank you to my dear friend, Representative Pramila Jayapal, who has been such an important voice in this fight. As you just said, I am one of the frontline members of Congress. And for those who don't know, frontline means that we are, that I, among several others, are in districts that are heavily targeted by the opposing party. People who won our re-election by very, very narrow margins. So the fact that I am coming out and speaking on this issue should say something to you. What it should tell you is how vitally important and popular the concept of expanding Medicare is. Because since I got to Congress in 2018, the number one thing that I have heard about, in addition to healthcare issues in general, but one of the biggest priorities that I have heard about from people is prescription drug prices. And I have promised to the people of my district that I would fight to lower drug prices at every possible opportunity. Making healthcare in general more affordable has been one of my first priorities since I came to Congress, including when I was campaigning to come to Congress. It was what I ran on, was making healthcare more affordable. But it's remained the same, and my desire to make sure that that happens has only grown stronger during the time that I have served in Congress, because of hearing from so many of my constituents, whether they're calling my office, writing to my office, talking to me on the street or in the supermarket, or talking to me at town halls. This is still the number one issue for most Americans. Unfortunately, you know as well as I do that although we've been able to take very important steps to protect and strengthen the Affordable Care Act to get people the care they need, there is still an awful lot of work left to be done to lower costs, particularly drug costs that have been far too high for too long. Just last week, drug companies announced yet another painful price hike on critical medications. The soaring price of prescription drugs is crushing Americans at the pharmacy counter, driving up health insurance premiums and creating unaffordable costs for taxpayers who finance Medicare. Pramila mentioned a few minutes ago the savings that we as a country would see, that taxpayers would see, if Medicare was given the option of negotiating drug prices with the pharmaceutical companies. Incredibly, and it's just hard to believe that cannot be done, at least not under the state of the current law. So instead of using their multi-billion-dollar windfalls from the GOP tax scam to either lower prices or to invest in research, Big Pharma has used that money for stock buybacks. Further evidence that out-of-control drug prices are padding corporate profits rather than fueling the search for new cures. I am really proud to announce that just today, a letter was sent to House leadership and to the Senate leadership. It was led by me and signed on to by 14 other of my Democrats in the Democratic caucus, all of us frontliners. And we sent this letter to urge them to include giving Medicare the ability to negotiate drug prices in the upcoming reconciliation bill. Now, as we mentioned, these are some of the most competitive seats in the country held by us frontliners. The fact that 15 of us led this letter to House and Senate leadership calling for this to be part of the reconciliation bill should tell you something about just how popular this is. And in addition to negotiating drug prices, I have to tell you, I hear from my older constituents all the time asking me, why is it that my teeth, my eyes, my ears are not considered part of healthcare for Medicare purposes? So yes, we have to expand those services that Medicare is able to provide. It is just common sense, and it's long overdue. No American should be forced into a possible choice between life-saving healthcare and life-saving medicine or food on their table. And it's unconscionable that pharmaceutical companies are still able to charge Americans 4 times more than what they charge for the same drugs in other countries, all while still recording massive profits. According to the CBO, the Congressional Budget Office, allowing Medicare to negotiate drug prices would save American taxpayers $456 billion in just the first 10 years alone. Pramila mentioned that a few minutes ago, but I think it's worth repeating. That's a staggering number. So when we are asked all the time, how are we going to pay for certain things that we are providing to the people of this country? One of the great first steps would be to have Medicare be able to negotiate prescription drug prices. And those savings would head right back into the pockets of American families. I'm so proud to be working with my colleagues across the Democratic caucus to get this into the reconciliation package and signed into law. Together, I really do believe that we can get this done. And I am incredibly grateful for this opportunity to speak about this, to tell you about the popularity of it among all sectors of my community, and to work alongside my wonderful colleague, Representative Jayapal, and all of these fabulous organizations to make this finally happen. Thank you.
Thank you so much, Congresswoman. Now, and thank you for your commitment to get these important reforms over the finish line. We'll now hear from 2 more representatives leading and pushing for expanding and improving Medicare, both from purple frontline districts. Representative Connor Lamb from Pennsylvania's 17th District, who is one of the co-leads with Representative Jayapal on the letter in support of Medicare expansion signed by 158 representatives, and from Representative Haley Stevens from Michigan's 11th District.
Hi, I'm Connor Lamb, and I represent a congressional district in Western Pennsylvania. It's not every day that you see Representative Jayapal and I on the same bill or pursuing the same idea, but this one is so important that I think it ties together the whole coalition of Democrats. I think it's really important that we lower the Medicare age. I was meeting with a group of firefighters here in my state last week, and they illustrate why we need to do this. A lot of people think if you're a firefighter, you sign a good contract with your union and you get health care for life, but that's not true. These guys represent one of the biggest cities in our state, and they typically get 5 years of health care after they retire. Many of them retire at 50, and so when it gets to be 55, they're on their own, and Medicare doesn't kick in for another 10 years. Now, you can imagine somebody that has fought fires their whole life, has breathed in toxic smoke and been exposed to chemicals and all sorts of workplace hazards. They have some health issues that they need to address, and insurance companies can't refuse to insure them, but there's no guarantee that they're going to give them affordable coverage. Those guys have been paying into Medicare for 35 years on average by the time they hit that retirement point, and I think they deserve to be able to take advantage of it while they're still young and healthy, and while they can keep the health issues that they do have in check and not delay care, as so many people do, to the point that it becomes worse on them and more expensive for our whole system. So this is a practical, common sense thing. We've all been talking for the last year and a half about frontline workers and how essential they are and how important they are. It's time for us in the federal government to put our money where our mouth is. This is important. It's just something we have to do. I really want to thank Representative Jayapal for leading such a big and diverse group of Democrats on this issue, for keeping the pressure on the White House. And I ask that you join with us to keep making the case and keep this on the top of everyone's priority list until we get it done. Thank you very much.
Hi everyone, it's Congresswoman Haley Stevens in the great state of Michigan. And oh boy, am I excited about some news coming out of Congress this week. It looks like in our budget negotiations that we are going to be in a place to do a Medicare expansion, meaning that seniors are going to have better access to dental and vision care. This is something that I hear from folks every single day, obviously with regard to the cost, but also the need that exists in our communities. These things are only going up if it's cataracts or special dental needs and on. And being in a manufacturing rich area, I want to make sure as we are putting the world on wheels and producing some of the country's best products, that we are also honoring our retired workforce and individuals who have contributed their entire life to making our economy strong, ensuring that they will retire with dignity and have access to good coverage, care, and benefits for the rest of their lives.
Thank you so much. And we are so grateful to all of our champions in the House and the Senate who are pushing hard to include these reforms in the Build Back Better package. Please sign the petition at strengthenmedicarenow.org to show that voters support these efforts from our champions. Now I'm pleased to welcome Brad Woodhouse, the Executive Director of Protect Our Care and former Senior Strategist for the Obama campaign and Communications Director for the Democratic National Committee. Thank you so much for being here, Brad.
Melinda, thank you. And I'm thrilled to join this incredible group. And hats off to you and Robert for having the foresight to plan this event the day after we learned what was in the package that the Senate agreed to last night. This could not be a more exciting time. And I just want to thank Congresswoman Jayapal and Congresswoman Wild, who we've done a lot of work with. Congresswoman Wild was rushed in to Congress on a sea of healthcare voters in 2018. 2018 was a healthcare election. If you look back just to 2017, when Donald Trump came into office, 2017, healthcare, the number one issue on the minds of the American people. 2018, the number one issue on the minds of the American people. 2020, up until the pandemic, the number one issue on the minds of the American people. And even after the pandemic hit, still number one, still number two, still number three. Our most recent poll that we did before the success of the American Rescue Plan really started to help ease some of the pandemic. Healthcare again was number two, and people said it was the number one issue they wanted dealt with in Congress, and the number one issue on the minds of voters. And guess what? The number one and number two issue were in healthcare. They were restraining high drug prices and protecting and enhancing Medicare. I mean, we could not have a better combination. We couldn't have a better and more historic opportunity. We have been so thrilled to work on this. I have to tell you, I reflect on what Congresswoman Jayapal said. When we were looking at this, and we were working very closely with Speaker Pelosi in 2019 on H.R. 3. That's a bill that included both of these policies that had Medicare drug negotiation and paid for the expansion of benefits under Medicare. It did not include the lowering of the eligibility age, but it did include the benefits. So we came into this fight thinking about the drug part, and we weren't in the families plan. Just like the additional Medicare benefits weren't in the families plan. We were in the president's speech, but we had to fight and fight and fight. And then we were sitting there thinking, well, wait a minute, why are we not getting enough traction on drugs? It's a 90% issue. It's 85% support among Republicans. And then we saw this letter, 158 members in support of expanding Medicare, lowering the eligibility age, expanding the benefits, vision, dental, hearing. And we were thinking that drugs was the engine and the benefits were the caboose. And now we're like, well, wait a minute. Maybe these benefits are the engine and drugs are the caboose. But you know what? We want the engine. We want the caboose. We want the tracks. We want the cars. We want the whole thing. And there's no reason we can't get it done. The American people want it. The only people that don't want this done are the pharmaceutical companies and the Republicans. And who gives a damn what the Republicans and the pharmaceutical companies want? We're in charge. We won the House. We won the Senate. We have the White House. We have an historic opportunity. And the beauty of this is it all fits together like a puzzle, like a glove. It's elegant. We've got the drug policy that can help pay for the Medicare policies. And we have the political high ground. There's virtually no American that doesn't want these policies. We are talking about 90% support, 85% support among Republicans. We're talking about the number one issue on the minds of the American people. And it's the right thing to do. We have the political high ground. We have an historic opportunity, and we just have to get this done. And thank God we got leaders like Congresswoman Jayapal. She's more on the Medicare benefit side. Congresswoman Wild has been fighting that letter today. I never thought letters were so important, but these letters have driven this. They've put this on the agenda. They help reframe our thinking and our advocacy, and we're in it to win it. So thank you, public citizen, for this. Thank you, advocates. Thank you, real people. And we are going to get this done. We're going to deliver for the American people.
Thank you so much, Mr. Woodhouse. We appreciate all that you're doing to move this over the finish line. Now I'm really honored to welcome Leah Greenberg, who's the co-founder and co-executive director of the Indivisible Project. Ms. Greenberg has been featured as one of Time 100's most influential people of 2019, included on GQ's 50 most powerful people in Trump's Washington, and ranked number 2 on Politico 50 list of top thinkers, doers, and visionaries transforming American politics. She's the co-author of We Are Indivisible, a blueprint for democracy after Trump. So thank you so much for being with us, Leah.
Thank you. And thank you. It's an honor to be here with all of you tonight. Representative Jayapal, thank you so much for your leadership in organizing the Congressional Progressive Caucus to stand up for so much that we care about. Representative Wild, thank you so much for speaking so eloquently to why this is crucial for every Democratic member of Congress from frontliners on down. Look, as Brad just said, I want to really underscore, these are proposals that are popular across the political spectrum. There is overwhelming support for Democrats, for independents, for Republicans, for empowering Medicare to negotiate drug prices, for expanding Medicare benefits to include vision, hearing, and dental, for lowering the eligibility age to at least 60 years old. Again, popular across the political spectrum. So it is not voter opposition that stands in our way right now. The challenge, the obstacle that we are facing is the political influence of the pharmaceutical, health insurance, and other for-profit health industries. A recent analysis showed that more than 2/3 of Congress cashed a campaign check in 2020. The largest insurance companies and their employees deliver millions in campaign contributions in every cycle. We know that these interest groups pumped up their contributions right around the time Congress was getting ready to take up a major prescription drug series of reform bills last year. Congress, we are about to see the same trend now. And that is why our job is to make sure that every member of Congress hears from and understands that their constituents need them to deliver bold and inclusive healthcare expansion as a critical part of our recovery. Now, the Senate's draft budget resolution today is a huge victory. It includes expanding Medicare to cover dental to vision and hearing benefits. The fight is not over, though. In order to usher in an equitable and inclusive recovery, Congress is going to have to do more. We have to push our elected officials to truly meet the urgency of this moment. We need to deliver not only expanded Medicare benefits, we need to lower the age of eligibility. We got to cap out-of-pocket costs for beneficiaries, and we need to lower prescription drug prices for all. Industry is throwing their cash and influence at this, but as you see tonight, we have got the momentum. The congressional letters of support signed by over 170 House and Senate members, including folks from the most vulnerable districts across the country, that tells the story. If we look back at 2020, the polling showed us voters trusted Joe Biden and Democrats to deliver on healthcare more than they trusted Trump and Republicans. Democrats were put in office because people believed that we would meet their healthcare needs. That is why we're here. That is why we have a mandate and an obligation now to deliver on healthcare, especially heading into a midterm where the historical trends are challenging. If we want to win in 2022, but more importantly, if we want to ensure that families around the country and vulnerable communities have the immediate resources they need to thrive, we have to include each of these priorities in the final reconciliation package.
Thank you so much, Ms. Greenberg. I'm now really honored to welcome Dr. Reshma Ramachandran, the co-chair of Doctors for America's Drug Affordability Action Committee. Dr. Ramachandran is a postdoctoral fellow at Yale School of Medicine and also serves on the board of Universities Allied for Essential Medicines. Thank you so much for joining us to share your insights on the need for these policies from a physician's perspective.
Thank you. And thank you so much to Representative Jayapal, Representative Wild, and the others on this call for protecting our patients and championing efforts to ensure affordable access to healthcare. This past year, besides witnessing the direct devastation of COVID-19 on my patients and their families, I've also seen problems that were lurking in the background become even larger and just impossible to ignore. More and more of my patients came into clinic telling me that this would be their last visit, that they lost their job and their health insurance, or that the costs of the co-pays for their visits, including for telehealth, were just too high for them to pay. More and more of my patients also told me that they would not be able to pick up the medicines I prescribed them, or asked me how they could ration the medicines that they needed to take every single day because of the too high price. These are conversations that were not just happening between me and my patients, but also with my clinician colleagues. And as our patients, around 40% of them were reporting difficulty around the country accessing their prescription medicines because of price, the pharmaceutical industry actually thrived. Not only did they score record profits from the sale of prescription drugs, but they also raised the prices of nearly 1,000 drugs in the past year above inflation alone. And this is also true for the health insurance industry as well. Now, as even more Americans become vaccinated against COVID-19, and we're starting to see glimpses of what a normal post-COVID life would look like here in the United States, my patients are still continuing to suffer from being unable to access affordable healthcare and their medicines. They're waiting to see whether or not our leaders will fulfill their promise of building back better. And for me, as a clinician, this means recentering our healthcare system around patients and not the profits of the pharmaceutical industry or health insurance companies. Building back better means fixing the mistakes from the past and allowing Medicare finally and other payers to negotiate the prices of prescription drugs so that my patients are no longer forced to abandon their medicines at the pharmacy counter because of the too high costs. And we can use these savings to build back even better by making sure we can expand Medicare to include essential health benefits, such as hearing, dental, and vision, as has been included in the recent budget deal, but also lowering the age of eligibility so my patients don't have to worry about not being able to see a doctor or getting a treatment because they've lost their job or the costs are just too high. My job as a physician is to make sure that I'm doing everything possible that my patients can live a healthy life. And this past year has just shown that this is just going to continue to be an uphill battle and something that's going to be impossible without bold change, such as Medicare price negotiation and expanding Medicare. So I just have one question for our legislators that are tuning in and also for our leaders in the White House. If not now, after we've suffered so much and our patients have sacrificed so much, then when? Thank you so much.
Thank you, Dr. Ramachandran. We appreciate all that you're doing for your patients and all that you're doing on the policy level. Now we will hear from the business perspective of how these health policy reforms would benefit employers as well. We're really happy to welcome Dan Wolf, who is the founder and CEO of Cape Air, the largest commuter airline in the United States, serving 500,000 customers a year. Cape Air is an employee-owned company and has 750 employees. Mr. Wolf also represented Cape Cod and the Islands in the Massachusetts State Senate from 2011 through 2016, where he served as chairman on the Labor and Workforce Development Committee. Welcome, Dan.
Thank you very much. And to the elected representatives on the phone, thank you so much for your leadership. I know how challenging it is in these times, and you're doing just a fantastic job. I want to thank you. Cape Air, over the years, from when we started with a handful of employees 32 years ago to now, we have employed thousands and thousands of employees. And as Melinda said, we are an employee-owned company. No single issue has been more important to our employees over the years than the issue of access to and the affordability of healthcare. And I will say, we just renewed our policy. And in a year where we actually got refunds from the insurance companies because they made so much profit, thank you to the Obamacare plan for that. There actually were refunds that came back. We just got a 10% increase in our insurance premiums, which is really kind of hard to understand. To insure a family at Cape Air, the range is anywhere from $30,000 to $36,000 a year. And so what I would say is this is the next step. This incredibly exciting legislation that's on the table is the next step towards the most important thing for the small business community in this country, which is decoupling over time. There are gradual ways to do this, but decoupling from business the responsibility, the access, and the cost of healthcare. That is the single biggest economic development driver that we can get behind to do this. So even though in the Massachusetts Senate I was known as a progressive, and in the Labor Committee I was known as a pro-labor guy, I'm also going to say from the business perspective, it is so important. Relative to our employees and their families and their communities, that is the issue. And as hard as we try at Cape Air, we are an employee-focused company. It is more and more difficult for us to provide the healthcare with dignity that our employees deserve and that they need. This is not an ideological issue. Cape Air serves the great state of Vermont, where Bernie Sanders represents. We also serve the great state of Kentucky, where Mitch McConnell represents. And I will tell you, having done Chamber of Commerce speeches and get-togethers and after hours in both of those states, both ends of the spectrum, there is universal agreement that we need to figure out ways to reduce the cost of healthcare to businesses that will allow the businesses to pay their employees now, expand other benefits, expand their business model, and be healthy in this economy. So more power to the folks, the leaders in Washington who are championing this, to Public Citizen who brought us together tonight. I cannot thank you enough. Anything I can do or others in the business community can do to make the case. This is smart business, not ideological. It's business development, it's growth, it's our economy, and it's the health and welfare of our citizens and our workers. Thank you so much.
Thank you so much, Mr. Wolf, for those powerful words. Now I'm honored to welcome Marissa Lee, who is a vice president of National Nurses United. Ms. Lee is a registered nurse who works in the labor and delivery unit at Osceola Medical Center in Kissimmee, Florida. Thank you so much for joining us to share your firsthand perspective on why nurses are behind these critical health policy reforms.
Good evening, everyone. My name is Marissa Lee, and I work as a registered nurse at Osceola Regional Medical Center in Florida. I'm also proud to serve as a vice president of the National Nurses United, the largest union and professional association of registered nurses in the United States. I have worked as a nurse for 36 years. I have cared for countless patients and their families who are not able to get health care because they don't have insurance, or because even with insurance, they can't afford the out-of-pocket expenses of prescriptions they need. When patients cannot afford the cost of the drugs they are prescribed, they often don't purchase them at all. And they choose to ration their medication, taking less than prescribed. When that happens, we see patients who come into the hospital with severe health challenges, the failure to take necessary treatments or delay seeking treatment altogether. The price of medication in our country is outrageous and atrocious. This is why Congress must act and mandate that Medicare be allowed to negotiate with the pharmaceutical companies to lower costs of prescription. As a nurse, we frequently see severe health diagnoses when people turn 65. Turning 65 is not some magical number where people suddenly get sick. It is, however, the magic number at which people currently qualify for Medicare. These diagnoses are often caught late. And if a patient has health care in the years before turning 65, these illnesses would be identified and treated earlier. It is the best interest of our patients to lower the Medicare age so they can get care that, that they need earlier. At last, I want to speak briefly about the difficulties facing older Americans who rely on Medicare. Right now, because Medicare does not provide coverage for dental, hearing, or vision care, a majority of our citizens don't get health care they need in these areas. As a nurse, I can tell you, your teeth, your ears, your eyes are part of your body, and it makes absolutely no sense that Medicare doesn't cover it. Millions of older Americans suffer because they don't see a dentist, optometrist, audiologist because of the cost. Nurses across the country are demanding that Congress improve and expand Medicare by lowering the cost of prescription drugs through Medicare negotiations, improve Medicare by covering dental, vision, and hearing, lowering the Medicare age, and capping out-of-pocket costs for all Medicare services. Thank you so much.
Thank you so much, Ms. Lee, and thanks to all of our nurses who have been on the front lines during this pandemic and are always taking care of us. We are so grateful for your service. Next, we welcome Diane Morgan from Cleveland, Ohio, and a grassroots leader with Our Revolution Ohio. Ms. Morgan has joined us tonight to share her own personal healthcare struggles and the urgent need for older Americans under 65 to receive access to Medicare with improved benefits. Thank you so much for joining us, Diane.
Oh, thank you for having me. I appreciate the introduction. So I'm 63 years old and I've worked all my life. I'm now self-employed as an urban farmer and I absolutely love what I do. But it means that I haven't had health insurance for the past 10 years. Not having health insurance or being eligible for Medicare means that I've had to go years without regular health screenings. And in fact, I didn't realize that I developed a chronic condition until I injured myself this spring and landed in the emergency room. So I wound up having x-rays and the outcome was diagnosed that I do have arthritis. I kind of figured that, but I wasn't sure. It's good to finally have a diagnosis, but what can I do about it since I don't have access to healthcare and I can't afford the out-of-pocket to pay out-of-pocket for doctor's visits? And if Medicare eligibility age was lower, I could have been diagnosed years ago and treated my arthritis all along. Instead, I've been left, guessing and trying to figure out how to address the arthritis as best I can. And as a result, I've had to scale back on my urban farming operations to ease the burden on my joints. And I've dropped down to 3 customers now. But even if I were eligible for Medicare, it's a shame that some of the basic needs I would have now, or that I have now, are not met. And here's an example, vision coverage. I had to get my driver's license renewed. And in order to renew your license in Ohio, you have to take a vision exam. Well, I knew I couldn't pass it. It's been 15 years since I've had my eyes examined. And it was only because of the last stimulus check then I was able to go get an examination, get a new prescription, and get glasses. And the other thing that's not covered again that we are aware of is dental. So it's a huge problem. And in 2019, I had a tooth that came loose, but I didn't have dental coverage or insurance. And so what I did was my best to prevent it from becoming infected by using herbal treatments until I was actually able to remove the whole tooth myself. I was fortunate that it never became infected and it was a clean removal, but not everyone is so lucky. So, you know, I'm thankful for that, but, you know, we really do need the dental coverage. But I was recently asked if I could if I had coverage under expanded Medicare, what would I wish for most? And my response was to be able to walk. That my arthritis has affected my ability to walk, to stand over the past few years. I do the best I can, but not being able to move as much as has resulted in weight gain and a lack of mobility. And I would love to be able to move freely again, go for walks like I used to, and even, you know, work out in the garden on the farm, you know, without having to use a walking stick. So that's my wish for myself. But this is so much bigger, this issue. So what I'm asking from everybody is for others, for future generations, please help advocate for expanded Medicare, because we have a responsibility to care for each other. So I thank you for the opportunity to share my story and appreciate this.
Thank you. Thank you so much, Diane, for sharing your story. Unfortunately, I think many Americans can identify with the terrible choices you've had to make of deprioritizing healthcare needs due to cost. And it just doesn't need to be that way. And that's why we're all doing this work. So thank you for joining us. Now I welcome the president of Public Citizen, Robert Wiseman. He's a staunch public interest advocate and activist, and he's an expert on corporate and government accountability, intellectual property, and access to medicines, among many other topics. Rob.
Thanks, Melinda. I want to thank everybody who's tuning in, because as important as everybody is who's speaking, it's the people who are tuning in who are the most important, who are going to make the difference in winning these changes we're talking about. And man, I want to thank you, Diane, for sharing that story. And your positivity and warmth and generosity is uplifting, but I will react the way human beings should react, not the way angels like you do, which is that is outrageous. And as you say, it's emblematic. And that's the problem what we have to deal with. And that's what we're going to deal with in this upcoming bill with the reforms we're talking about. In our country, Americans pay 2.5 times the price for pharmaceuticals, for prescription drugs, as people in other rich countries. 2.5 times. As a direct result, 1 in 8 people who need insulin skip their shots or go without. 1 in 8 people who need heart medicine skip their medicine or go without. Overall, 3 in 10 Americans ration their drug treatments. 3 in 10 Americans. At the same time, the drug companies are draining Medicare because through their manipulation, they have prevented that system from negotiating drug prices. Is there any reason in the world for this? Well, actually, the answer is yes. There's one reason. And the one reason is the political power of the drug companies. At the same time, Medicare is not delivering on its promise and its commitment to seniors because it doesn't cover all that needs to be covered. It doesn't cover dental, it doesn't cover hearing, and it doesn't cover vision. It socks too many seniors with too many out-of-pocket costs. Why? Are we short of money? I'll tell you what, we're not short on money, because if we had Medicare price negotiation, we could raise all the money and more that we need to expand that coverage for Medicare. Why doesn't Medicare cover what it should cover? Because the health insurance companies want to have a weak competitor and siphon business away. Is there any other reason in the richest country on earth? No, there's not. It's as simple as that. The drug companies and the health insurance industry are preventing people from getting care. they're charging too much, and they've been getting away with it. The exciting thing about this moment in time is they ain't gonna get away with it no more. This is our time to start having Medicare negotiate prices, save money for the system, plow it back in and expand coverage, strengthen Medicare the way it should be, lower the age to bring more people into the Medicare system. When we do that, and we are going to do that together, we are going to do that. When we can do that, we finally are going to uphold our commitments to seniors and to all Americans, because in this country, in every country, but in this country, no one should be going without health care. Thank you all for all you're doing. There's going to be a lot of work in the coming weeks, but we're going to get this across the finish line. Back to you, Melinda.
Thank you, Rob. And if you haven't already, I hope you feel riled up enough to sign the petition for action at strengthenmedicarenow.org. That's strengthenmedicarenow.org. And there will be opportunities to get involved in the coming weeks. Now I'm happy to welcome Melissa Burrows, the Associate Director for Strategic Partnerships at Families USA. Ms. Burrows leads the Oral Health for All campaign to improve oral health coverage policies. And she can share with us just how important it is to add dental, vision, and hearing services to Medicare in this legislative package, given all of the work that you all have been doing. Thank you.
Thanks, Melinda. I think we've got a different face on the screen. All right, there I am. Hi, folks. Thank you so much for having me. Thank you so much for being here today. As Melinda was saying, now is the time to get riled up. As Representative Jayapal and Representative Wild were saying, now is the moment to make sure that our health does not depend on our wealth in this country, or where we live, or the color of our skin. When Medicare doesn't cover dental or vision and hearing care, it really means that our health depends on our wealth. It's outrageous that we are paying into Medicare all of our working lives, and it doesn't even cover our eyes, our ears, or our mouth. And so Families USA is here to help us all work together and get this over the finish line. We're so thankful to be working with all of you, and this is really a moment to move this forward. And so as you can tell from the intro that Melinda gave, we have a really long-term campaign where we've been working to improve oral health coverage. Of course, vision and hearing are huge gaps that matter too. Of course, prescription drug pricing is something that matters to millions of us as well. And we are just so thankful to be here with all of you moving this forward, because dental, vision, and hearing coverage really matters, and people are suffering without it. I want you to imagine, a storyteller that we've worked with. Her name is Cheryl, whose dental problems cause her severe pain and limit her diet because she can't afford the care that she needs. We've heard many stories like hers, but not only is she suffering from oral health issues, but her problems make her diabetes worse, and she often gets acid reflux because she can't chew her food enough. It really is, degrading her ability to take care of herself. Despite the fact that she has Medicare coverage, she's really not able to be healthy without these critical pieces that leave care too expensive and out of reach. So no one in this country should be left in that position. No one should have to choose between their oral health care and putting food on the table, especially when they might not be able to eat it without that care. But we're seeing this over and over again, that is happening. Oral health care is the #1 skipped medical service due to costs in the United States, even more so than prescription drugs and medications, which we know is an incredible difficulty for millions of people as well. And, without Medicare coverage, we see 2/3 of Medicare enrollees without dental coverage. So as a result, we see people that are unable to maintain their health. We see people that are unable to get jobs because employers often make decisions based on appearance. Many seniors face social isolation even before the pandemic. They were too embarrassed to, show their teeth. The pandemic has made social isolation an even more difficult problem for many, many people. And so as we are rebuilding and recovering from the pandemic, as we have this once in a lifetime opportunity to really make some progress on some things a lot of us have been working for a long time, it's time to invest in dental, vision, and hearing coverage. We have a way to pay for it. We have a way to, really get the ball rolling on this issue that is so wildly popular with voters. So in summary, Medicare dental, vision, and hearing coverage is a health issue, it's an economic issue, it's an equity issue, and our health shouldn't depend on our wealth, but that will only be possible when Medicare covers the whole body. So thank you all for joining me in this fight, and we look forward to working with all of you.
Thank you so much, Melissa, and for all that you're doing for dental health, oral health in this country. It's also really, really important to hear from workers and unions who have joined in this advocacy effort. Unions including Communication Workers of America, United Auto Workers, SEIU, American Postal Workers Union, and more have all signed on to an organizational sign-on letter in support of these policies. And now we will hear from Elise Bryant, who is the president of the Coalition of Labor Union Women, Afl-Cio. Ms. Bryant is the executive director of the Labor Heritage Foundation, and she is a member of CWA-TNG Local 32035. And we are really grateful to hear your perspective and the perspective from workers about how lowering the Medicare age and capping out-of-pocket costs could really improve their lives.
Thank you, Melinda. I have to say, I am pumped up. Melissa, I had not heard that before, that our health should not depend on our wealth. And I have to congratulate you on the diversity of this panel, from elected officials and doctors to a frontline nurse and an urban farmer. I am honored to be here with all of you. And the song that came to my mind is, "Healthcare is a human right. We are going to expand Medicare. Healthcare is a human right. We are going to expand healthcare, Medicare. Healthcare is a human right. We are going to expand Medicare. It's gonna last forever and ever. We're gonna expand Medicare." Hey, sisters and brothers, siblings, comrades, family, I bring you greetings on behalf of the members of the Coalition of Labor Union Women. The coronavirus pandemic exposed how insufficient and inadequate the safety net and social insurance system is in this country, as many of the speakers before me have said. While the coronavirus pandemic has underscored the importance of unions for working people in general and for women workers in particular, the benefits of union membership predate the pandemic and extend to a broad swath of the U.S. workforce. But whether union or non-union, all workers will benefit from lowering the age for Medicare, not just those who are able to afford better insurance. Beth Mickus, a member of Service Employees International Union and chapter president of Southwestern Pennsylvania Coalition of Labor Union Women, Pittsburgh, shared her story with me. Beth said, "For me, this is personal. At the age of 55 now, and diagnosed with epilepsy at the age of 35, nothing matters more than my health. 10 years ago, I had a grand mal seizure, was in a medically induced coma for 4 days, hospitalized for 10. I went to stay with my mom as I needed to recuperate. I was off work unpaid. I missed the invoice of one insurance premium, and my medical insurance was suspended until I could pay $33,000 usage fee. It's been 8 years, and thank goodness for Obamacare, but we can do better. $550 a month plus over $300 for prescriptions is a lot. I'm grateful to have something, but we all deserve better. I'm fortunate I can afford this, but nobody should have to pay to be healthy." For Beth, and for most working women, lowering the age for Medicare will help save money across the board by giving people access to care earlier and thus allowing providers to both detect and treat emerging conditions. The Coalition of Union Women is proud to stand up for lowering the age for Medicare because all workers, but especially those essential workers, deserve health care coverage so they too can continue to experience life, liberty, and the pursuit of happiness. Thank you for inviting me.
Thank you so much, Elise, and thank you for sharing music with us, because this is our fight is a joyous one because we know that we will win. And thank you for bringing that, and as well as your expertise and your passion. And last but certainly not least, we have a message from a hero to many of us, Mr. Adi Barkan. Adi is a lawyer and was the founding director of two major projects at the Center for Popular Democracy, Local Progress and the Fed Up campaign. And when he was diagnosed with ALS, he co-founded Be a Hero to confront members of Congress about healthcare using the power of the human story. And so we are grateful to get to hear a message from our hero, Adi Barkan.
Hello, friends. Thank you to Public Citizen and Representative Pramila Jayapal for inviting me to speak today, and to all you engaged citizens for taking the time to listen. I'm grateful to be in your company, even though I had to pre-record this. Right now I'm picking up my 5-year-old son Carl from one of his final days of preschool and taking him to swim lessons. It's a highlight of my week, and I wouldn't miss it, even for a great town hall like this one. Fatherhood, for me, is actually a great place to start talking about healthcare. Because the reason I'm choosing to be with my son today is the same reason I've been fighting for healthcare justice since my ALS diagnosis 4 years ago. Simply put, our time on this earth is the most precious resource we have. And as it stands, our healthcare system in America deprives people of that one most precious and irredeemable resource. Hours wasted on the phone fighting against an industry whose entire business model is built around denying people care. Days spent sick, going without necessary medical care because the cost of treatment is out of reach, or will lead to bankruptcy. Years, time, our most precious resources, lost, ultimately, to this moral abomination of a system. It just doesn't need to be this way. In the richest nation in the history of the world, we can afford to guarantee everyone in our country gets the health care they need. The pandemic has revealed the devastating consequences of our broken healthcare infrastructure. Over 500,000 lives lost. Brothers, sisters, mothers, daughters, fathers, friends, neighbors. We must work now to make sure more lives are not lost to this inadequate system. Working towards a more just healthcare system, I believe, is a positive moral choice, yes, but also a smart political move. Democrats barely squeaked out a victory in the last presidential election, and we're headed for a big fight to hang on to our thin congressional majority in the coming midterm elections. Across the country, people of different regions, races, and religions say the most important issue in their life is health care. Health care reform is incredibly popular. A whopping 83% of voters support strengthening Medicare to cover hearing, vision, and dental care alone. So let me say in no uncertain terms, if Democrats do not deliver on health care before 2022, I believe we will lose. As I mentioned, one of the changes I believe Democrats in Washington need to and can make right now is a bolstering of Medicare to cover the whole of people's bodies, eyes, ears, and teeth included. We also need to lower the Medicare eligibility age from 65 to at least 60, and ideally younger, so 23 million more people can gain access to the care they need. We must put a cap on out-of-pocket expenses, a burden subjected disproportionately on the poorest and sickest among us. And once and for all, we need to empower Medicare to negotiate prescription drug prices just as the Department of Veterans Affairs is permitted to do. No senior should go bankrupt to access necessary medications. Now these may seem like incremental steps, but taken together I believe they are the groundwork we need to one day build so that at last we may live in a nation where health care is not a privilege but a human right. Thank you for your time and your work. We don't have any time to waste. Let's build a more just healthcare system today.
There's no way to follow the brilliant Adi Barkan, so I mostly want to leave it right there, and I want to thank him and all our brilliant and passionate panelists this evening who have inspired us all to take action. We simply cannot let Congress pass up this chance to transform our healthcare system for the better. The time really is now to expand and improve Medicare, to cap out-of-pocket costs, to lower prescription drug prices. Workers, patients, businesses, seniors, people who aren't yet seniors need these reforms urgently. If you haven't already, please go to strengthenmedicarenow.org and sign the petition to Congress. Momentum is on our side, as we've heard this evening, but we need to all work together in the coming weeks to convince our senators and representatives to deliver on these promises that they have made to us in these coming days. So stay tuned for more opportunities to take action, stay part of this fight, and have a wonderful evening. Thank you so much for joining us.